Hi, this is Renu Wang from MHC. Today we're at Grand Coptham Waterfront for the second annual Healthcare and Insurance Collaboration Forum 2011. Dr. Low Lee Yong is invited to be one of the panelists to speak about balancing necessity of treatments with cost. Let's take a look.
And for the other role, the other part of the equation we must not forget is the role of the primary doctor. Unfortunately, the role of the primary doctor has been very much played down recently. You know, if your child is sick, you go straight to a pediatrician. If you have a little pimple, you go straight to a dermatologist. These are things that drive up the cost. And if you go to you have a ward, you go to a national skin center, they'll make you come back many times just for all the histo freezing, you know, all this deep freezing and so on. And many visits. And all these are expensive. You go to a GP, if the GP is well equipped, well trained, you can just zap it off and that's it. You know, it's a fraction of the cost. So the role of the GP must be really brought back again. And most of these poor GP out there are literally suffering. And when they're suffering from high rental and competition cutting at cutthroat price and so on, what do? They resort to selling cough syrup. They resort to selling sleeping pills. They resort to becoming a beautician, Botox injection, liposuction. These are, I hope the authorities, you know, realize that these are signs and symptoms of a broken healthcare system that need to be repaired. The GPs are hungry. They're in trouble. If you don't take care of them, basically, you know, they have to think of other ways to make ends meet. And they went through medical school for 5 years and just to become a beautician, it just doesn't make sense, you know. And we have to address their problems. And of course, the GPs themselves must play the role of an effective gatekeeper. And the only way to do that is to let them do, you know, what is necessary for the patients. And before the patient walk to a specialist clinic, they must go through a GP, get a referral letter, and the GP must be the center point of care where he moderate whether this person should go to an orthopedic surgeon or a plastic surgeon, and then, you know, all the information to go back to the GP who really gatekeep. I think that is one of the primary points that we have to stress as a gatekeeper role of a GP. Of course, the GP themselves are not saints, because we ourselves, for my company, we process millions of claims, and I've audited tons and millions of GP claims. I know they do, you know, I do see frauds too. In fact, we have to report police for one GP who tried to cheat the insurance company. Unfortunately, these are facts of life. And the only way you can control and manage the situation, you must have a powerful system that track all these transactions at the point of the visit. Transparently, if the patient is not entitled to a certain benefit, tell the GP so that he knows what to do. You know, empower the GP with the information at that point of transaction so there is no dispute with the patients. And if you wait for reimbursement to happen weeks later, firstly, it drives out administrative costs. You end up spending all your resources on data entries unnecessary. And then if you're trying to spend all this money to audit a GP claim that costs $30, please spend more time auditing the specialist or the hospital claim that costs thousands of dollars, probably more cost effective. So you must have a very powerful IT system that link up all the parties concerned, empower them with the information transparently. And then we should have a database that is published transparently so that, you know, all the players involved knows that, oh, this guy is much more expensive than this guy. This guy treats diabetic better than that guy because his HbA1c record is so much better. If we have this kind of information transparently, just like the way hotels are being listed one day, perhaps there will be the patient will be empowered with the information to make the right decisions, and maybe that situation will get better.